better than Perth today.
Well, it's something like 24 today, so it's like, it's really nice outside. But the conversation that we're actually having is so vital for so many women out there to understand what is going on with their bodies, and when it's not functioning properly or you're not feeling well. Why is it? Is it because you've got irritable bowel? Is it because you have inflammation of the gut? What, all these things that we're truly not really aware of when we honestly say that, are we?
Well, I think that, Faye, what you're talking about there is symptoms that so many women will have, right? So, for example, irritable bowel type symptoms. And that is, in my opinion, not a clinical diagnosis. It's simply a collection of symptoms that hasn't been put into a box that gives a clear enough diagnosis yet. And I think all of these things are warning signs that there's something that's out of balance with the body, right? All of those symptoms are just, if we really bring it back to its most basic sort of picture, is that these are signs and symptoms that there's something that's wrong. There's something that's out of balance. There's something that needs to change in most cases.
And would you think a lot of the time that when we have, an irritable gut or an inflammation in the gut, it's got a lot to do with what we eat?
Of course. Of course. There's the two main things that would be causing that, in my opinion. One would be stress, because of how stress affects the gastrointestinal system. There's so much research now that has gone into the microbiota, so the trillions of symbiotic bugs that reside in our gastrointestinal system, and the conduit that controls that, which is the gut-brain axis, which is the vagus nerve. And the vagus nerve is so susceptible to stress. So as soon as we're stressed or anxious in our brain, within 20 seconds we feel that, or there's that flow-on effect that changes in our gut. And when we're, for example, when we're stressed, our body thinks we're running away from a saber-toothed tiger, it diverts the blood away from our gastrointestinal system, which means that, all of the opportunistic bugs or, whatever it might be, it's the perfect time for them to be, wreaking havoc on our system. And that's just one example of that. And just at its most basic level of basic physiology, if we don't have that adequate blood supply to, our small and large intestines, it's not going to be functioning adequately.
There are so many things there's so many questions that I want to ask you, but let's continue. We've talked about, aging after you have a hysterectomy, and, if you have your uterus removed only and you keep your ovaries, or you have it all removed, and how it changes the function of your body. But there's so much else. I mean, endometriosis, and there are so many young people that are living with that. Why?
Oh, that is, such a good question, Faye. And, endometriosis is one of the most painful conditions that women can experience, in my opinion. And I've never seen patients suffer the way I have than those who come in with endo. And it was actually a patient with endometriosis initially that started me on my obsession with women's health. That really sparked that for me and forced me to go back to uni and do my postgraduate master's in the things that we talked about earlier. And it was because of the fact that this woman had been suffering for 20 years and had literally tried everything, and her life was so dramatically impacted by her period, and she dreaded her period every month. But she was also in pain every single day, not just when she had her period, which is so true for so many women who do have endometriosis. And at the moment, statistically, it's about 11% of reproductive women in Australia that they think have endometriosis. However, Based on what I'm seeing in practice, I actually think that it's much higher than that, because it's often about a minimum of sort of 7 to 10 years to get an accurate diagnosis of endometriosis. And women will often see somewhere between 5 to 7 different practitioners before they're actually given accurate information about what their symptoms are representing. And part of that reason is because that a proper official diagnosis of endo requires a laparoscopic surgical procedure with histological evaluation of that tissue to confirm that, yes, that is endometriosis. So women have to have surgery to be told what their symptoms mean. Whereas in my opinion, I absolutely think that endometriosis can be diagnosed via symptoms and a really good transvaginal ultrasound, a diagnostic ultrasound alone. I think those two things, in my opinion, can absolutely be diagnostic, but at the moment, still the gold standard of that is with that laparoscopic procedure. And I think that we still don't have a proper understanding of endometriosis. And medically, there's lots of different theories around what causes it and how it's come about. And they're anything from, retrograde menstruation, which is where essentially the menstrual blood does not come out through the cervix and through the vagina normally as it would. Some of that regurgitates back up into the uterus, and that becomes problematic. But this actually occurs in the majority of reproductive women anyway, and not all reproductive women have endometriosis. So I just don't think that that's a good enough, explanation of why that happens. There's all sorts of other theories about, whether or not this is something that they were born with. So during that embryological development, some of those cells grew outside of the uterus, and then they sort of get switched on or activated with the onset of puberty. So they were already there to begin with. And there's so many other things that sort of go with it. But we do know, and the research is now really showing, that endometriosis is an immune-mediated inflammatory condition that's exacerbated by hormonal imbalances. And it's the hormonal imbalances that become really tricky in the health and medical space, because some of those aren't genuinely sort of acknowledged as to what that sort of looks like, because our hormones are so much of a moving target. And it can change every few days of our menstrual cycle. So having an assessment of that sometimes can be challenging for, patients and practitioners, as well as to how to interpret that information. But we do know that it's driven by the immune system. And there's some really incredible research coming out that is sort of showing these sorts of things, and how, inflammation is contributing to it so dramatically. And I think that this is almost like the canary in the coal mine for our health, right? That this is a perfect analogy for the fact that we're living so differently, and our diet and lifestyle and our stresses and everything else are just not conducive for optimal health or optimal hormonal function or optimal immune function. And we can see that through generations as well. Often women who have endometriosis that I see in practice, often there's some sort of history of maybe mum had fibroids or grandma had fibroids, or maybe grandma had a hysterectomy, but they don't exactly know why. Or because of, I think women inherit sort of not endometriosis, but some sort of crappy hormonal function, and maybe their hormonal detoxification pathways and the way their body metabolizes those are compromised, or they're doing things in their lifestyle that drives those inflammatory responses. Does that sort of make sense, Faye?
Yeah, and God, there's so many questions that I want to ask here. And is it that, you said we can inherit it, a lot of the time I personally would say it can be exacerbated by our diet and our stress levels and things like that. And to find someone, a practitioner, who can diagnose it for you, and as you said, it's either done through ultrasound, etc. That's one way of doing it, which is less invasive than having an operation and testing the cells and things that way.
Yeah.
How do young girls prevent or slow the process of this down? How do we educate them to understand that if this is the beginning of something, what do they do to prevent it or to
Ooh.
slow the process down?
Such a good question. Again, Faye, I love that you're asking me all the big stuff. Now, look, they may already be showing signs and symptoms of this even before they actually get their first period, with the onset of menarche. So they may not even know that they have endometriosis, but as soon as they get their period, there could be signs and symptoms of that. So sometimes, we may not see it immediately, but other times we will. And otherwise, sometimes when we're seeing it later in life and women's periods are getting more and more problematic as time goes on, then we need to do a really thorough hormonal health history and look at all the possible contributing factors to why this might have taken place, and whether or not, this woman has had a history of other comorbidities, for such things like, has she had some sort of autoimmune condition, or have there been other endocrine disorders going on? Does she have a history of chronic UTIs or interstitial cystitis, or has she had some sort of pelvic inflammatory things before, which have changed those immune factors that could be contributing to this inflammation and pain? So understanding those sorts of things for sure. And also just looking at her previous contraceptive use as well, because there is some research that shows that particularly teenage girls who use oral contraceptives, it increases their risk of deep infiltrating endometriosis, which is the endometriosis that sometimes we'll see that grows within the bowel and everything else. So this is sort of more advanced endometriosis. Now, I'm sure that there's research that also shows the opposite, that possibly, and oral contraceptives are used as a treatment strategy for endometriosis at the moment, which
That's a bit scary.
Well, and look, this is certainly my bias as well, that I think that there's certainly a place for that. However, oral contraceptives were designed for contraception. That's what their purpose is. And now they're being used off label for everything under the sun. And what I've seen in practice is certainly that they've become more problematic when using those sorts of things. And often it's just a bit of a Band-Aid, and it's not actually addressing those underlying factors. But also, in a lot of the previously, the older generations of oral contraceptives, which a lot of women are still on, sometimes those, for example, the estrogen that's in those pills are up to 10 times stronger than what our own body makes. And estrogen can be incredibly pro-inflammatory and is also associated with much higher pain issues as well. Just as an example. I think I totally got off track there, Faye. What was your question? I totally digressed there.
It's really interesting because I want to take you to the hormonal imbalance that most women have.
Mm-hmm.
And it can be caused by diet, it can be caused by contraception, it can be caused by wrong diagnoses. It can be caused by so many different things. How do we know a lot of the time that our hormones are not in balance? How do we know?
I think that, and the most simple answer that I have to this is if you have any symptoms. So
what are the symptoms?
Well, in my opinion, a normal period, normal menstruation is symptom-free, which means no pain, no excessive bleeding, no spotting before the period, no really heavy cramps, no night sweats before the period starts, no insomnia, no, menstrual migraines, no menstrual cycle exacerbation of disease, no really severe breast tenderness or women turning into completely different people 2 weeks before they get their period. It's probably the nicest way I can say that. And There's, PMS symptoms can be so severe that they can also reflect something called PMDD, or premenstrual dysphoric disorder, which is a very a severe version, for lack of a better term, of PMS, where women can feel suicidal. Some will even report feeling homicidal. They can have very severe, extreme physical symptoms as well. But, depression and anxiety and everything else can be so extreme during that time that it really interferes with their quality of life. And they're often, prescribed things like antidepressants because of those symptoms. And this is obviously, in my opinion, an extreme version of a hormonal imbalance. And that's what it's driven by, right? There's a shift in their hormones, which is causing these symptoms. And therefore, that's what we should be looking at as the treatment strategy for that. So in my opinion, a normal period, normal menstruation means no symptoms. A normal bleed is about 5 days long, sort of 4 to 5 days. It should start with fresh red blood. It should be heavier on the first couple of days and it should taper off to nothing. There shouldn't be spotting for days before the period starts. There shouldn't be severe, really heavy bleeding. There shouldn't be really heavy clotting. It should just start, taper off to nothing. And then, a month later, we get a similar sort of thing. So
but these women that live with a couple of weeks before the anxiety, the stress, all these things that they're feeling that they haven't got any control over, then they go through the menstrual cycle and then they come out the other end and they've probably got a week and a bit before they go back into it again.
Yeah, exactly. Yeah.
How do you change that?
In my opinion, I think that's one of the easiest things to, clinically, in terms of the things that I deal with. Things like PMS symptoms and premenstrual dysphoric disorder is pretty easy, in my opinion. And you've just got to look at what the underlying drivers are for that. And the most common hormonal imbalance that I see in practice is symptoms of things like low progesterone. But it's not just low progesterone in isolation, because every single hormone works as part of a beautiful hormonal symphony within the body. And if we do a quick little sort of hormonal 101 now, Faye, so you can sort of have a bit of an understanding of that, and this will sort of give you the kind of big picture around this. So if we look at the main hormones that are responsible for the menstrual cycle, estrogen is this beautiful feminizing hormone that we have that develops our hips and our boobs and our butt. It gives us that nice, tight skin, that youthful glow. But estrogen is also really important for our bone mineral density. It, is essential for our brain health and our immune system as well. And all of its actions are actually really, really far reaching. There's so many different things that estrogen does within the body. It's not just reproduction. But estrogen is definitely has a bit of a Goldilocks effect as far as I'm concerned. So we want not too much, not too little. It needs to be just right. And when estrogen is in excess, and a lot of people might have heard the term before called estrogen dominance, and I think that's a bit of an erroneous term because it doesn't become dominant. It's just excessive, relative to other hormones. Then it does make us feel much more anxious. It makes us fixate on things. It can increase fluid retention. It can make us gain weight. It also can be pro-nociceptive, which means that it increases our pain responses as well. It can make us feel pain much more significantly too. And there's really good research that actually supports this whole hormonal pain sort of interaction. And when estrogen becomes excessive, normally the trade-off is that we have low levels of progesterone relative to that. And progesterone is known as nature's Valium. So it's that really beautiful, sedating sort of hormone that kicks in the second half of our menstrual cycle. So we make progesterone from a part of the ovary once we ovulate called the corpus luteum, which means that it's really important for us to be ovulating to make that progesterone in high enough levels that would keep us feeling really good in that second phase of our menstrual cycle. And progesterone is also responsible for stabilizing that uterine lining. It has this inverse relationship between that and pain chemicals called prostaglandins. So when we have good levels of progesterone, usually our period pain is less as well. And it's one of the most important hormones that's responsible for the maintenance of, or the early stages of pregnancy as well. So progesterone means progestation too, but its effects are very far reaching.
Okay, we've got to go for a break, but we'll be back